I gotta look in your ears.
Dad,
Yeah, who looked in your ears today?
that was Jennifer.
Jennifer, did she look in? Yeah. And how'd you do on the testing?
Good.
It was good?
I became interested in pediatric hearing loss because I really wanted to focus on a medical and surgical specialty where I could see huge improvements in children's lives and in their families' lives. When I was looking for a job and a clinical practice to join, I wanted to make sure to be a part of an environment where I could do research and see patients clinically. So both my research and my clinical practice focus on children who have hearing loss. Some days I'm in clinic seeing patients, some days I'm in the operating room, but then I also just love being involved in research so they can make big advances. Only at Boston Children's was I able to do both of those things. I'm Eliot Shearer. I'm a pediatric otolaryngologist at Boston Children's Hospital. Her hearing
is fabulous.
amazing.
Yeah.
And-
Saying mama, dada, more.
Yeah,
No, of course.
Yeah, no, it's okay. I specialize in seeing kids that have hearing loss, specifically trying to determine the cause of hearing loss and then figuring out the best way that we can help children to experience the environment around them with the best access to sound that they have available. When a child is diagnosed with hearing loss, a lot of families can feel very overwhelmed. And what we work to do at Boston Children's Hospital is come up with answers for the patients and families. For the majority of children with hearing loss, through a multidisciplinary approach, we're able to determine the cause of the hearing loss. And this is very important for families to understand what the prognosis is, whether there's any associated medical conditions, and what the future holds for their child who is affected by hearing loss. It's such an exciting time for children and families that are affected by hearing loss because we have all sorts of different options available for them. What I work to do with my clinical team as well as the clinical trial team is try to figure out the best treatment option for any family. And this is where it's really personalized medicine. Because we have a bone-anchored hearing program, a hearing aid program, a cochlear implant program, and now a gene therapy program, we're really able to offer the full spectrum of treatment options that are available. To me, I think there's nothing better than improving the quality of life that a child has. I think the greatest thing that I get to see on a clinical basis is seeing families interact with their children in new ways once they have better access to sound and get to experience the world around them.